Good afternoon, everybody. This is Janelle Pecano with the Ohio Department of Mental Health. We are getting ready to end or begin today's webinar. Apologize again for the delay. We've had trouble getting a phone today, so I know that there always seems to be something that's going on. So we are going to go over some FAQs and then have the opportunity for people to ask questions. If you registered for today's technical assistance, I did email about 25 minutes ago a sort of a PowerPoint. And I'm watching. I do see that it's stating that the audio is not very good. It's fading in and out. Hopefully people can hear this. I'll try to step back a little bit and speak into its overhead mic here. And after we go over the FAQs, then we'll have the opportunity for people to answer questions. Trying to get this through. That didn't work. Somebody just posted, can I send info to call in on the phone for better audio for that individual? When you're connected to the webinar, there is a control panel, and one of your buttons is audio. The default is microphone and speakers. If you click that and change it to telephone, then it will give you the phone number to call in. Got a slideshow, so I think we're up. I think we're good. As I just said, we're going to do some questions. And I apologize. We were working on the phone. I didn't have time to really get this set up at my end. And then if you want to ask a question in writing, submit it, then on your control panel there's a question pane. You can type the question in there and then hit send, and we will go through the questions as they come in. We will take, if people want to ask some questions out loud, then as time permits, we'll try to do that. There's not a lot of questions that we have prepared in advance. The intent of these technical assistance sessions is to basically answer provider questions, not for the department. Do that. So if we've gotten a few questions in, we'll go over those. So if don't know how many questions people have, but at the end, if people want to speak, you have to be connected to the webinar via the phone, or you have a microphone on your computer, or use a headset with a mic. And if you do that on your control panel, there is a box to raise a little icon to raise your hand. If you raise your hand, then I can go in and unmute you. Now, if you participated in the webinar, the original training webinar on the application on June 14th, there was a slide that I went over, like tips, and I talked about it later, but I didn't have the slide up. I was having a lot of trouble getting back and forth, so I didn't want to take the time to do that. So I've got that slide up here again. We've asked, one of the questions is, when are these applications due? There's no due date for a health home application, but we've asked if people could get them submitted by August 1st. That would be helpful to the Office of Licensure and Certification. But please understand, we are committed to reviewing all applications in as timely fashion as possible. We can't guarantee a certification date because we don't have control over the applications coming in, that it's inspected, it's complete, as well as it's compliant. once that date that we have everything and it's complete and it's compliant, then if that's before October 1st, that will be the provider's date of certification, October 1st. If you're phase 1, those persons will get certified prior to that time. If on phase 2 county, if the board was going to fund it, I don't think there's any boards out there funding it right now. We could certify prior to October 1st. We would want to have a conversation on that. So, also to make sure people are aware that their effective date for Medicaid billing may be later than date of certification. That doesn't mean it will be, it's just that may. And then I will, so I just want to go over that, and then I will advance. Please note, this came out very late. I did not have, there's no spell check or anything that was done on this PowerPoint, so I apologize in advance for the typings that I'm sure that are incomplete. We've gotten questions on whether or not we're going to release sample documents, and we do not have any plans to do so. And those questions have been in reference to the comprehensive assessment, the integrated care plan, the comprehensive assessment update. You know, providers can develop their own. If you're currently utilizing electronic health record, we're working with your vendor on that. If you're planning to acquire one within 12 months of certification, which is a requirement, then you can also work with your vendor on that. But one of the questions does an agency need to use the same position titles as in the rules for health home staff? With 4 members on the health home team. There's the team leader, the embedded primary care clinician, there's the care manager, and a qualified health home specialist. And there's no requirement that you utilize those same titles. When you're submitting your position descriptions, you need to make sure that you clearly identify which position and which role they're going to fill. Because, you know, some persons or some organizations use what is kind of sort of like a working title and then a position title. So, for example, a working title could be whatever your organization wants to do. I think an organization wants to use some different like care levels of care manager, 1, 2, 3, 4, and then your position title could be a leader or a qualified health specialist. Ask to explain the difference between the primary care clinician and the provider of primary care services. I want to make sure that people understand the embedded primary care clinician is a member of the health home team. So that, you know, it is one of the 4 member, or not 4, one of the 4 roles. And I say roles because some of the different roles, you may have more than one person that's fulfilling them. In an organization for qualified health home specialist might have 2 or 3, or a care manager, they may have 2 or 3. In the rule, it says that it's preferred, but it's not required that the primary care clinician, and there's a typo right there. This is primary care clinical may or may not provide physical health care services to individuals receiving the service. If you're utilizing an integrated, coordinated, and you have an agreement with another organization to provide the primary care services, that does not replace your responsibility to have an embedded primary care clinician on your health home. That's what we're looking for in the crisis and contingency plan. And this is information to the consumer, who is a family guardian, on actions to take in crisis when certain events occur. You know, these could be behavioral health events, these could be physical health care events. These could be if you have a person who is a diabetic and they're monitoring their own, and they're able to monitor their own blood sugar levels, that they know that if the numbers get within a certain value or outside of a certain value that they either need to contact the health fund team, their primary care clinician, whoever. It could be in certain steps, and one of the goals of health home service is to eliminate unnecessary trips to the emergency department for hospitalizations. It may be so that the person understands when they should call 911, if they should go to the emergency room. So you do this based upon the assessed needs of the consumer, and it's reflective of the consumer's level of, there's my separate second one. Level of, I can't even think of what I was planning to write in there, but it's based upon their level of risk. Thank you. And if that is in the room here, and you've seen these slides for the first time. So on page 4A of the application, and this is the assurance checklist, these are some primary care screening items that the applicant needs to attest to. And there's a question, or it states that they must have a physical exam within 2 months of the first scheduled visit with the provider, if that one hasn't been performed in the prior 12 months. And so what does that measurement take for 2 months? So the provider here, we're referencing the health home service provider. So if the individual had a physical health exam within 12 months, then you don't need to do that. And if they haven't, then it must occur within 2 months from their first scheduled health home service contact. And this is where we think of the idea, and some of us, ourselves do them, some do not, the idea of people having physical health exams. What health home activities have to be performed by licensed individuals? And part of this comes in the context of there's the 6 different health home service activities, comprehensive care management, care coordination, health promotion, and who can provide those services. So as with any other service, you have to practice within your scope of practice. And unlicensed staff can perform any activity that doesn't require a license or other credentials. So within those 6 broader categories of the different components of health home service, there's no comprehensive care management, or you're doing a comprehensive health assessment, integrated plan. Those activities just require somebody who's licensed. But when you go into the different activities, maybe under health promotion, depending upon what is being provided there, and other services, just please look at the individual activities. Is certification of health home service site specific? It is not. We do ask on the application for providers to list their different service locations where they intend to provide health home service, and some of that also ties to then your model of providing integrated physical health care, behavioral health care services, but it is not a site-specific service. So once your organization gets certified for health home service, you may provide that service at any certified location. And again, I'd like to remind everybody that services, sites where you're providing health home service, do need to be certified. Now, that does not extend to providing the physical health care services if you have an agreement with another entity, maybe it's a doctor's office across the street from your health home, and that's just, they're providing physical health care services here. That site doesn't need to be, if it's a service under the health home activity. And just also putting up there again that if you have any questions on health home service, Rob Nugent, who is a lot of people are familiar with Rob as the role of community client safety manager, is one of the supervisors in the office of certification. And there's his email, that's the new email format for the state, went live I think today. And that's his phone number if you want to call him, he will get back to you. That is, that's the end of the questions. I need to in our part. There was one question on any info on rates yet. The purpose of the webinar is to discuss the health home application. We understand that people are very anxious to have that information. As soon as that information is available, it will be, we will get that information out to you through probably through the Medicaid health home newsletter that goes out at least once every week. That's if we'll be sending a copy of this and all other future PowerPoints to all agencies. We do not. They go out to people who are registered. And let me switch over here to this screen. That is the Ohio screen on the certification. And then when you go to certification applications, and if you're not sure how to get there, you can go, type in certification application up in the search function. You see up here is the health home supplemental application, the resource document, and then the webinar that was done on June 14th is posted there, as well as the training PowerPoint that accompanies it. So we make them available on the website providers. And we have a director of health home, a team leader, a care manager, and a qualified health home specialist. If you're talking about the, I'd say, working titles that your organization uses, the answer would be yes. But in the context of that question, you've got the team leader, that's one of the requirements. A care manager, that is one of the requirements. A qualified health home specialist. If by director of health home, if you mean the embedded primary care clinician, then you could call that clinician the director of health home, but it doesn't read that way. Because we're not going to prescribe to you what your working titles are going to be, but you have to have an embedded primary care clinician on the team. So in this case, when you submit a position description, if you did for a director of health home, we would look at that position meets those requirements and the duties meets the embedded primary care clinician on the, in the role. And your team leader is the team leader of the team leader of the health home service. And if your organization is planning on having multiple health home teams, you wouldn't have like a director of health home and identify them as overseeing all of the different health home teams. That would be embedded primary care clinician. We have been told the client claims data will be provided in July. Do you have an estimated date by when the info will be provided? That should be available within the next, by the 10th webinar? Yes, July 10th. That should be available by July 10th. There's a webinar scheduled on July 10th, tentatively scheduled. I don't know. They haven't sent it out yet, so they've got that tentatively scheduled. When that webinar goes out, it will include some information on that. So, question, what do we mean by non-community location in regards to the ODMH certification? If when any type of service that may be provided in the community, so for example, the PTSD component of health home, if they're going for clients' house, or perhaps if it's part of one of the health promotion activities your organization you do every week, there's twice a week, do some meetings at a local gym, do some physical health exercise. Those would be community locations, so those do not need to be certified, but if it's in location where the agency is operated. Agencies with multiple locations, so we just copy the first page of the supplemental application to list all service location addresses. Yes, I think there's room for 3 on page 1 of the application, and if you need to make additional copies of that page, you can do so. And then the table, table A of the application, the first table, is also can be copied if you have some different models for integrated behavioral health, physical health care that you provide at different locations. So you do not have to, you're not submitting one application to each location, you're submitting one application for each for health home service, and indicating your different locations. There's a question. Is the application you sent with the recent email the new revised application? It is not. That will be available by tomorrow. That was sent out just for people to have it, as a ability to get that if they reference this. Any questions today? Questions for the webinar on July 10th to be recorded. The department does always webinars on health home service or technical assistance. We always do intend to record them. Sometimes that doesn't work properly. And so if the recording doesn't go through, you can't make it available. And then there's related, since the viability of our health home will be largely dependent on meeting our projected number of employees, hopefully we learn how enrollment will work. That would be the webinar that we should tentatively send on July 10th. Right now, that is that's the extent of the questions writing. Updates on eligibility criteria. Again, that information will be on July 10th. And not trying to put providers off. We understand that it's part of finding your service, completing your application. The information is not available. So we can't provide you information that we don't have. They're working to make sure that the information is available. It is the correct, right information that we see. Nobody has their hand raised to want to speak, and that's, again, if anybody has any more questions, if you want to submit them, that I don't know if you have anything you want to add. You said no. She's just glad I'm not saying as a contact problem, failing on her and throwing her up there. But for those of you who did inquire post last or the webinar on the 14th, my eye is fine. Sort of the hazards every once in a while. Contact the lines off, not dead centers. But again, you have Rob's information. And if you have any questions, we are following everything through Rob. He is the health home lead in the Office of Licensure Certification. He'll be working with the surveyors once applications are submitted, make sure that everything is processed. There's not anymore. There are technical assistants. There's another one next Monday. They are scheduled for today and the following 4 Mondays. There are people are registered for all of them. We want to put the time up there. We'll go basically as long as people need to. So we just want to make sure that we've got the time set aside. At this point, we have no more questions coming in. I know everybody's busy, so we'll go ahead and end today's webinar. And if something comes up, email us in between or join us again next Monday at 1:30. Thank you.